nice. We get to take our masks off and communicate like this. This is great. Okay, I'm going to be talking about the Bad Ragaz Ring Method, but not the whole technique. I'm just going to be looking at how to apply tactile cues in particular and handholds to the lower extremities to assist with balance. So I'm trying to keep it very balanced, focused. I gave you all a handout. Let me share my screen here. You guys see this research here on the screen? Okay, since that's what's popped up, that's what I guess I'm going to start with. This is a research that I found regarding muscle activation on lower limbs and balance ability with chronic stroke patients. And they were using lower extremity patterns 1 and 2, the flexion, extension, internal, external rotation with abduction, adduction, eversion, inversion. And what this, it was really well written study, the way that they did their control group and selected their clients. What they found was that the group that received the Bad Ragaz and also the group that had really good on-land physical therapy, both had strengthened their tibialis anterior and the gastrocnemic muscles. Their overall conclusion was that the Bad Ragaz Ring Method may be beneficial for improving balance and leg muscle activation of chronic stroke patients. And I'm going to put this, I'll drop this into the chat box in a little bit so that you have it. Because it was actually one of the better ones. A lot of the research that I looked through for Bad Ragaz, because it is, there's a lot of variables, like who is providing the treatment, what is the background of the clientele. But this one, they did a really good job of isolating the water depths, the selection of the criteria for their inclusion clients, the exact patterns that were used. So I really like this one, but I will include that into the handout. Now I'm going to switch screens. Let me close that. Do you guys see the art of balance using Bad Ragaz? Okay.
Yes. Yes.
Good. Okay. This was the handout that I sent out, and I wanted to have on this time. This week, enough time to get through a lot of the video that I put together. And I'm going to be following exactly what you have in these notes when you see the videos. The videos are done directly off of the notes. So as we go through, we're going to look at the position of the body in the water, because that will greatly affect the person's ability to recruit balancing muscles. If their body position isn't right to start with, you're not going to be able to elicit the correct muscle chain response. So the first video we're going to look at is going to address that. And I'm going to switch screens, and it's going to go over all of the timing, the quality of the movements, the repetition, the hand positioning. We're going to do the body positioning first, then we're going to do the hand positioning for the reflexes on the foot. So let me switch screens here. Share screen. Here we go. Hello, welcome to the Art of Balance using the Bad Ragaz Ring Method. I'm going to show a few little nuances that you can add to the Bad Ragaz that you're using right now that assist more with proprioception and joint approximation, so people can feel the balance or the chain throughout their body while they're floating. Where you have the equipment placement, depending on your client, it's going to greatly affect their movement and also the muscle chain response. Some people, if you put the float at the knee, it causes a relaxation and a flexion, a pelvic tilt into a posterior tilt. If you move the rings or the devices that you use down towards the ankle, with some people, they feel more stability this way. It also puts a little bit more extension into the thoracic spine. And some people will go into a pike position, feeling like they're having to hold themselves. People with back issues typically prefer to have the under the knee position. Now, the arm position is also going to greatly affect the individual's balance in the water. You don't want having somebody have too much lateral instability. And if the arm floats are placed in next close, more medial to the body, it creates more lateral instability for people. If I put it out farther, they have more lateral stability. Now, some individuals will want to, give me your arm, give me your arm. Some individuals will want to remain in external rotation. External rotation creates this back extension. Other people are going to have their arms down at their sides like this, and this creates a little bit more protraction, rounding of the shoulders. So depending on your client's condition, if they have a cervical issue, a thoracic issue, pelvic, leg, how the placement, just the floating placement, is going to assist and become part of the treatment. It helps with body awareness, and you want to start in the right starting position for the desired exercise. How do you feel in this position?
A little uncomfortable in the low back.
In your low back, right? So for you, if you put your arms up like this, that's putting her more, I don't know if you can see it on the camera, but that increases your her thoracic extension, and that feels better to you.
Yes.
Right. Mm-hmm. Now I'm going to have you put your arms down at your sides where you were, internal rotation, and I'm going to move these down to your ankles. A little bit out to the side. How do you feel now?
Pretty good.
So I didn't want her to have all that thoracic extension starting for her exercises. I know she's had cervical surgery. She also has a torn labrum, and she gets pain in the thoracic region. So I didn't want to put it on the stretch. So just changing the equipment was helped her with balance in her body. Okay. Now, we're going to come down here to the feet. And on the soles of the feet, we have lots of receptors. The feet, the hands, the inside of the knees have a lot of receptors, the armpit, the lips. So we're going to work with the foot receptors. In order to get somebody to go into dorsiflexion, I'm going to pull on the top of the foot, and that makes you want to pull your toes up, correct? Yes. Now, if I also pulled on the tendons on the foot, does that? Okay, I am back, and I'm coming into here. Okay, so just having the placement of the equipment, as we saw, greatly affects your clients. I did not mention the need for having the right cervical collar. Different collars do different things. You've probably all heard me say that there's long necks, fat necks, skinny necks, short necks, red necks, every kind of neck out there. So having the right equipment that allows somebody to relax their head and their neck, you can usually tell by looking at the scalene muscles. Once you've relaxed the head and the neck, then you can go forward with working on stabilizing. Besides the key components to walking balance that I've listed here, there's also vestibular proprioception, ocular perception, as well as having control of the hip and rotation, internal, external stabilizers of the hip, knee and ankle, leg control, and core stability being a big one. If the core isn't stable, it's hard to control the extremities. And ankle range of motion is imperative. Some people, when they lose that ankle range of motion, they must compensate. So in assisting, Bad Ragaz is really good at helping assist people find a center of balance, and you can slowly learn to reload to help re-educate balance stabilizers. The next video is going to show that, and certainly if anybody has any questions, pop it into the question box and I'll pause the video and address anything. So there's going to be a lot going on in this next video. Oh, let's see here. Let me get to the right one. We're going to go equipment placing, and then this one is foot cues. Hopefully you see the video. Depending on where you place your hands, either on the dorsal surface of the foot or on the plantar surface of the foot. When you're on the...
We're not seeing the video.
Oh, you are? Okay.
No video.
Let me stop here. Stop share. Screen share. Foot cues. Thank you for chiming in. Can you see it now?
Yes, that's
Okay.
better.
All right. Thank you very much. Okay. Let me put in here. Dorsal surface of the foot or on the plantar surface of the foot. When you're on the dorsal of the foot, the top of the foot, you want to make sure that you're right at the base of the toes, and I actually give a little pull and a drag up, and I'm going to pull up, and then if I want her to push, she's going to have a surface to react upon. So she's pushing with her great toes into my hands. Good. And then she's pulling up with the feet. So you want to make sure you stimulate the digits. Where you place your hand on the bottom of the foot is going to also elicit responses. If I push right into the center of the foot, right in here, you feel that all the way through your body, right?
Yes.
Yes. That's the positive righting support reflex. And it's right in the center of the foot. So if I want to load the ankle, the knee, and the hip, I'm going to push right into that spot. Right into this spot. Some people I have to come inside. If I start pressing on the inside, I'm going to get inversion. As you can see, it's starting to happen. If I press on the outside of the foot, you're going to get eversion. And the weight is going to go up the lateral border of the leg. So hand placement is critical. The Babinski. Okay. So you can see that where you place your hand and the timing of the hand placement is going to help elicit it's a reflex. It's a response from your client, right in that center of the foot. When you'll see in another one where I do a simulated walking, I'm really pushing into that spot because it loads the weight all the way up the muscle chain, and you can direct it medially or laterally, depending on how the person is presenting. If there's somebody who stands in external rotation or a hip hike or internal rotation. And we're going to explore a little bit more of that here in a moment. Anybody have any questions? No?
Julia, I do. What
Yes.
do you do if people's feet are ticklish?
Oh,
I mean, it sounds really weird, but if you guys saw me cringing when you were doing the feet, it's because my bottoms of my feet are like major ticklish.
no, that's good. When you're in the water, are they as ticklish? Okay. I've put neoprene socks on some people because it just dampens the sensation. You can use any kind of good sock.
Okay, cool.
Yep, that will help. And I mean, I've done it, and when I've been teaching the Bad Ragaz courses, people in the courses have shoes on sometimes. That's not ideal because you can't elicit the right response, but for you, it might be just the right amount.
Yeah, really. Okay, cool. Thanks. That's a great idea.
You're welcome.
I also have a question. If you have somebody who has like neuropathy that doesn't have a lot of feeling in the bottom of the foot, do you find yourself pressing a little harder, or do you have to just, what do you do with you have somebody who has a little neuropathy on the bottom of the foot?
Right. Using that positive writing support in the bottom of the foot, they will not just feel that in their foot when it's applied, it's actually really felt in the hip. It's directed like straight through the knee and the hip. If you just start working on the feet there, it's either going to be too much, like pins and needles, a tingling sensation, or you're going to get a reflexive withdrawal response with the foot. So I make sure that once my hand is in place, I don't move it around a lot. It's just on one surface or the other. I certainly don't hold both sides of the feet at the same time. And a lot of what you're going to be seeing in the videos is you'll see that only one surface at a time is only touched. That client there in the video, she's a post-stroke, and she does have neuropathy in her left foot.
Okay, thank you.
Yep.
Yeah, I was just going to
So
make a comment. It's really nice.
Please.
The touching of their feet and getting that proprioception, because especially our older clients, they have those high stiff arches. Their foot never really comes down and mobily adapts to the ground, so they don't get that stimulus. So I think that's really important that you're getting in there. So thank you.
Good. Thank you, Beth. Good. Let's see. Somebody had left the question. Let me just look at it real quick. Oh, that's from, yep. Thank you, Connie. She said, same for neuropathic sensitivity in the feet. Okay. Now we're going to go, this next video is about 10 minutes long. It might be a little bit longer, but it is going to have a lot of information in it. So try not to get up and leave during this time. Oh, let me hit that. Share screen. I need to go to my videos, share.
It's not a full video, Julia.
You don't see it?
No, we're seeing your files and a slight video off to the side.
To do because, okay. Let me stop share. I need to go through and get rid of some of those. Now you got it.
Yes, now we have it.
The bilateral movement through their body, and relax your legs and get you all the way up in the corner so that we have the full length. So I start this one passive. We're going to do one passive. I'm going to add passive assist, and then we're going to do it active. So passive on the dorsum of the foot, plantar surface of the foot, and I'm going to alternate. And I'm approximating using that positive writing support right into the bottom of the foot. I'm gonna go the other direction now. Push, pull, push, pull, push, pull, push, pull, pull, pull. And I'm gonna come back towards you. And the direction of the push, the approximation, is literally straight down in from the bottom of the foot and the ball of the foot into the knee, into the hip. And she can feel that all the way through. I'm going to switch legs. And again, it's a pushing all the way through. What you don't want to have happen is you're in the wrong angle when you push, their knee bends. Like that. Bend your knee. So what you don't want is this movement. You don't want this knee bending movement. No, it needs to go. This is the step off foot, so it's dropping down. Weight's coming into this foot, pushing into the hip. Switch, it goes down. This one comes up. And now I want her, you don't walk around with your arms up in a giant Y. So we're going to change her arm position. Like this. Good. And I'm coming back. See the difference? Yes. There's a big difference that she's feeling in her body. She's starting now to feel that contralateral movement, also in the scapula. Good. And I'm going to relax. Now, I'm going to ask her to become a little bit more active in this. So it's an, that was a little bit active assisted, but let's see how active she could get with it. Okay. Stepping, good. Stepping, good. Step, and step, good. And step, and step, good. She really does have to think about it, even though she was just doing it, active assisted with me. For her to become more active, it's difficult. We'll try it one more time.
There's a big difference in her left foot.
And step, and I'm feeling her push now pretty good. Nice. And depending on how somebody is using their weight, we want to get them to feel the weight-bearing chain in the correct part of their body before they start transferring it onto land and getting more and more compensations. We want to address the compensation here. So if she was standing on the outside of her foot all the time, see if I press on the outside, how her leg wants to go out. You feel that? Yeah. Now, if I press on the outside of the lateral border of her other foot, I can transfer the foot into abduction out to the side. If I want to bring it back in, I'm going to be push with your toe, push with your toe, push, push, push. And now I have this internal rotation. Good. And relax. I switch hands. And I'm going to have her push with her toe. And I'm on the instep of the foot. And she's going into internal rotation. And I'm pulling back the whole time on the dorsum of the opposite foot. Good. Now I'm going to go into external rotation. Good. And here I'm working with the primitive reflexes of the foot, mainly the Babinski reflex and the it's the Babinski positive righting support and the tendon guard reflex that are in the foot. Okay, now if somebody has a wide gait, they're circumducting their foot, or they're leaning onto their assistive walking device and swinging their leg around, or they're just afraid of falling and they have this really wide gait stance. We want to help the person bring that weight more into midline instead of way out to the side. We want them to feel it midline. When I do that, we can use the Bad Ragaz technique. If she was a very wide gait walker and I want to bring it more into midline, I'm going to have her stand on my hand and she's going to pull up with her left leg, bend your knee, push your weight into your right leg, straight knee on your right, bend the knee on the left. Good. Good. Now this is where I correct a lot of patterns and relax. Hold, relax. Now she had a very wide stance and I had her pull up on the right, push onto your left, bend the knee on your right. Sorry, my bad. Bend the knee on your left. Good. And if she starts bending to that direction right now, she's bending to the left. I want to correct that. I'm going to say, don't pull as hard. Good. Pull up still. Push your belly button to the ceiling. Good. Keep pulling up with your left leg. Hold it. Breathe. And relax. If the client starts, as they pull up and they don't have the strength in the hip flexors, they're going to start pulling to the side. Don't let that happen. Allow them time to keep and work with your handholds on their legs, on their feet, so they can feel the right chain. It's a big difference, is it, if I move my hands on the bottom of your foot? Yep. Okay. So right now, we're gonna do internal, external rotation with the feet. I'm gonna give her a cue, bring your heels together, good. Keep your heels together, push your toes out in distance. My hand comes on the instep. Bring the toes together and drop the heels out. Heels out to the sides. Good. Internal rotation. I know that's difficult for her. Good. Now I'm going to bring heels together again. Good. Now bring the toes together, heels out. Oh, good. I know that's difficult, right?
Yeah.
It's a lot of energy. Good. And relax. Okay. Nice. Now I'm going to do the opposite leg and see what the difference is between the two. I'm placing my hand, positive righting support, right in the bottom of the foot, and Babinski. I'm getting all of it. Okay. So I'm going to push, and I'm going to say, with your right leg, bend your knee. Good. Stand on your left leg, and I'm giving pulsing, little pulsing into the center of her foot with the heel of my hand. Good. Breathe. Don't forget to breathe, and relax. So I'm going to help with a little bit of that external rotation that you saw there. I'm going to change my hand positioning on the foot. Good. Pull back with your toes. Stand on this foot. Good. Now bend your knee on your right leg and hold. Good. And relax. Relax. Good. Now with that wide gait, if we had somebody with the wide gait, I would want to keep bringing from all the way out here. This is where they want to be. If I was their foot, pull up with your right foot, bend your right knee. Good. Now, if I want to bring her from out to more medial, I'm going to bring the whole thing in and put the leg into internal rotation. Internal rotation and pushing. See how the weight is on all your adductors?
That feels good.
And it feels good to her. Yep. Because I'm preventing that external rotation. Relax. We're going to do that again. So as opposed to having that external rotation, circumducting movement of this leg, if this is how she was walking, like this, now we're going to take it from that external position. I'm going to bring it internal. Yeah. And now I'm going to place my hand along the medial border of the foot and up to the great toe, keeping my hand off the lateral border of the foot. This leg, right leg, I'm going to have you pull up and now stand on this left leg. Internal rotation. You can feel that all the way up the midline of your body.
Yes.
Good. Good. And relax. I'm going to place my hand so you can see the difference on the lateral border of the foot. On the lateral, good. Pull back with your right foot, bend the right knee, and now she doesn't have, this is how her instability. Good, and relax. Hello. Not sure, my screen is kind of frozen.
Okay,
Stop share. Can you hear me?
yes, we can.
Okay,
We've got you full on the screen.
all right, great. Well, there was a lot of, that was packed full of, chock full of information with the feet. But it's really important to be able to do this in the water. You have a lot less fear of falling. And I've watched some really good YouTube videos for some PTs that work with spasticity. And I saw how this would play really well, that technique that you just saw, especially with the circumducting, to the exercise where the PT will have the client standing right next to a wall so that they're stable and they're being able to move their outside foot in a little bit of a forward step or put the toe down behind them. So they're actually loading the leg that's nearer the wall. So this one would play really nicely into that land-based therapy for helping bring the gait more midline as opposed to that large circumducting movement. Is this helpful, seeing it all in the pool? It makes, okay, good. Good. And this should all, everything that I wrote down in the notes that you have there are really the highlights of what I'm doing in the videos. The next one is, along with circumducting, some clients that have spasticity or they have an upper motor neuron lesion, the corticospinal injury, they'll do a supination of the foot where the foot wants to turn in. And it's usually corrected with AFOs and a lot of physical therapy. The next one is a 1-minute video just showing different similar handholds to what you've seen, but specifically targeting the supination. Let me navigate there without losing everybody again. I need to delete a bunch of these now. Okay, here, share screen. This is the only way I know how to get there. Supination, okay, and then
Okay.
I have to, yep.
Okay, we're seeing your files and the video off to the side.
Okay, so I think I have to start the video, stop the share screen. seems to be working the only way it's working.
Okay. All right.
Yeah, sorry, without me wasting a lot of time.
There you go.
This is a supination. So to prevent supination, I'll put my hand hold, as you saw earlier, on the medial portion of the foot, and I'm going to put the foot and the whole leg into internal rotation. This then will have her do eversion. Heel of my hand comes into the bottom of the foot, and I have her preventing her from doing supinating of the foot. I'll do it on this foot also. If you bring the knee, the hip, everything into internal rotation, and your handhold is on that medial border of the foot, it's going to prevent that supination. You can't roll your foot inside if you wanted to, could you?
No.
If you wanted to do a foot roll, yeah. Okay. Supination, adduction. Okay, so we've been looking at a lot of the reflexes on the bottom of the foot. The Babinski reflex, I'm sure you're familiar with it. If you go up the bottom of the foot and across the ball of the foot, typically toes will curl or push. So by pushing on the pads especially at the great toe and into the great toe, that helps elicit some of that primitive Babinski. Something that would be abnormal Babinski is if you did that and the whole foot the toe came down and everything flares out. So you can still work with the Babinski reflex with the foot, even if they have got a positive Babinski. You just change where you're pushing, and you can tell by how the toes will flare when you start pushing onto the bottom of the foot. But as you see, the holds they're very flat on each surface, and adding pressure to exactly the point that you want them to react upon. If you give them too much surface, if you're holding both sides of the foot, or if you're holding the heel and the top of the foot, it's almost they're getting too much input and not quite sure which way to go. So you have to command the direction and the push and the pull by where your hands are, or they're not going to get the right response. Okay, next one. I'm going to go over here. Got all these videos. That's good. Thanks. And this is going to be adduction, abduction.
Okay, Julia, I think you have to do the same thing again because we're getting your files.
Okay. Okay. Here we go. Boom.
You got it.
Okay, good. There we go. Adduction. So when we do adduction, we want to get the leg in the right position for adduction. We don't want the legs in external rotation unless that's your therapeutic goal is to work on external rotation or internal rotation. So I'm going to do it first with neutral, then external rotation, internal rotation. So the adduction is bringing the legs together. Because we want to strengthen the adductors, but also when we're doing Bad Ragaz, the leg that I'm stabilizing, we're also working on the gluteal muscles, medius. So I'm going to keep her leg in neutral. My contact is on the lateral border of the knee, the lateral border of the foot. I'm going to say, open your legs, open. Good. And close your legs. Good. Let's see how far you can open them up. Open, 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 open. Keep pushing. Keep open, open, open. And pull together. Pull, 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 pull. Good. So abduction is opening, and I want to focus just on adduction, just the closing part. So with the closing part, relax. I'm going to step back in relaxation to open her legs. Then I'm going to ask her, pull the legs together. Pull, pull, pull. She relaxes. I lift the leg. I step back with it. Hand is on the instep. Close. Good. Relax. Passively open the leg and close. Good. Now, if I want to add internal rotation to this, I'm going to ask her when she closes her leg to try to bring the toes together. And again, relax both your legs. I'm going to hold this leg, slight internal rotation. My hand is going to go on the instep of the foot, just below the joint of the great toe. I'm going to step back. Pull your toes together. Toes together, pull them together. Pull, pull, pull your toes together. Good. And relax. I'm going to step back again. Pull the toes together. Good. Now I'm going to do one with external rotation. I'm going to take her leg, put it into external rotation, and I'm going to step back. Bring your heels together. Heels together. Good. So heels together. If she can, she's going to externally rotate this foot and bring it together. Let's see how we do this time. Relax your legs. I step back. External rotation. Heels together. Pull, pull, pull. Good. Perfect. Good. So internal, external, and neutral. And it all depends on what muscles you're trying to localize for their balance. So that was adduction. Abduction, I think I did it at the beginning, but let's do abduction with internal rotation. That's a really tricky one to do. Okay, so
Julia, you're frozen just a little bit.
I'm gonna
There you go.
of the leg, the knee.
Thank you.
Stabilize the knee joint. Never on top. Always from underneath.
I don't know if you can see
The other
that. It
hand is
says
on the
my
lateral
internet
of the foot, or
internet
it's
connection is
gonna be on the
unstable.
instep of the foot. Okay. If
Okay, I'm not seeing that, but it might just take you in and out a little
you
bit.
press, I want you to push your heels out away from each other and open your legs. Good. Open, open, open. That's tricky. Good. Relax. Good. Good. I'll bring your legs. I'll bring them back together. Now we're going to keep them neutral and just open your legs. Open, open, open. I'm giving a pulsing. Pulse, 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 pulse. Open, open, open. Good. Now I'm going to stimulate this part and go close, 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 close. Good. Now, if your client has very tight adductors, we can do a couple of things here. We can do pulsing into the coronal muscles. Pulsing, 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 and it actually makes the legs open.
Okay. They come back to me. Okay. Anybody have any questions?
Okay.
No.
Julia, just to let you know, you've got about 4 minutes.
Okay. Well, I will show another 4-minute video then. Why not? All right. We have choice. You could see one with a single leg flexion, extension, internal rotation, hip extension movement, which is like the D. It's a modified D2 on a single leg, or I can show a little bit of pulsing and how I use pulsing into the muscles. What do we have a vote for?
Or I have a little one on an actual another client that has had a stroke and how I combine a lot of things together with her.
Okay, maybe something that's 3 minutes and then people have time for a quick question and then we wrap up specifically at 9:50 East Coast time.
Okay. All right. Be right back with another video. Let's see. Let's do the pulsing.
Okay, then you have to get out and get back in again.
Stop and share, and here we go.
Awesome.
Couple of things that I do, kind of little tricks. I add a lot of pulsing. I might do rapid pulsing into the bottom of the foot that I showed at the beginning, that positive support. Yep. Deep tendon reflex. I'll come across the bottom of the foot sometimes. Yep. Right up here, pushing into the ball of the foot. Eliciting some of that Babinski, getting the toes to push, and a lot of tactile, extra tactile cueing. Work with the all these fine receptors. Another one I like to use is if somebody has very, very tight adductor muscles, I'll do pulsing into the IT band and into the peroneal muscles. So if I can't get the legs apart, I will pulsate into the muscles, pulse, 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 deep pulsing, and then I can pull them apart. Pull the legs together, good, pull together, good. If she had very tight adductors where we couldn't get the legs apart, really tight all on the midline, I'll come in and I'm gonna put all my fingers together and I'm gonna pulse into, I'm gonna ask her, try to keep your legs together, okay? This very tight adductors. And this is not a big far stretch for her because you do have tight adductors. Yeah. So I'm gonna come in here and I'm gonna pulse at the IT band. 2 different spots, middle, lower, and then at the peroneal muscles. And I'm gonna come into the instep of the heel and I'm gonna pull apart. Ta-da! Hard to hold your legs together, isn't it?
Yes.
Yeah. It's really important also that you use a pelvic support for this, because that will help inhibit your gluteal muscles quite a bit more. So using the pulsing to inhibit adductors works well for this. It also works well in the Halowick technique. Okay, thank you. Okay, stop. All right.
Okay, we are right at 9:50, so we're gonna have to end here. So everybody, I'm gonna end this. Get out of this one, get in quickly to the second video or the second Zoom that Angie sent you, and we'll see you back here at 10 o'clock Eastern Standard Time.
Okay, I'm answering a question down below. Somebody asked me if I use these primarily with CVA clients. I use them both with ortho and neuro clients. It's a form of neuromuscular re-education, and I keep the movements when I first start to like 6 repetitions at the beginning. You're not doing 20 repetitions. I'll start 2 to 3 if they're really weak, and then do 6 repetitions, and then finally work up to like 2 sets of 10 or something like that. So
Okay, that's it.
thank you for your
We
time.
gotta go. Bye.
Bye.